Buvunanyisibwa bonange noli buli omu wali wali singa buli omu wali afayo buvunanyisibwa bonange noli buli omu wali wali singa buli omu wali afayo.
The government of Uganda has made significant strides in bringing about positive changes in the health of its citizens. However, chronic underfunding, centralized decision-making, and a lack of accountability and transparency continue to impede effective implementation of policies and delivery of critical health services. In June of 2014, Advocacy for Better Health, a Usaid-funded project, was flagged off. The project was implemented by PATH and Initiatives Incorporated.
We have three major objectives that we aim at attaining. Number one is how do we empower the citizen on their rights and responsibilities to demand for quality, available health and other social services.
Throughout its lifespan, Advocacy for Better Health mobilized and empowered citizens in the 35 districts of operation with knowledge on their rights and responsibilities related to health and social services using the Ministry of Health Patients Charter.
Our mandate as Advocacy for Better Health under the community empowerment aspect of the project was to work with communities in the 35 districts to make them more active in monitoring health service delivery, detect any challenges that are happening, and have these community groups or these communities develop action plans that they can use to engage their leaders to overcome those challenges.
The project used popular platforms to achieve this, such as radio, television, print, and online or social media. This was complemented by the work of 479 community groups identified and trained by the project in citizen-led advocacy. The groups mainly used the face-to-face approaches such as community meetings, drama shows, and advocacy forums.
Okubeera champion mu grupu okolera wamu ne members banno nembeera nga mugezaako okuperereza ebyobulamu okubeera nga bigenda bulungi mu kitundu awamu n'okutaasa endwadde n'okulwanirira obujjanjabi bw'abantu b'omu kitundu. Twafunye obugaali okuva mu kitongole kya PATH oba USA nga butuyambako ku ntambula ebadde etukaluubirira okutuuka mu bitundu ebyewala. Twebaza ebitongole byebale nnyo byebalire ddala.
At the same time, the groups created awareness on the 90-90-90 HIV treatment targets in line with the new Test and Treat policy that was introduced by Government of Uganda based on the 2015 World Health Organization treatment guidelines.
Health is a right. It is not optional. And since the government has that responsibility and the mandate and the resources, it became necessary to have advocacy because we believe that within the government systems, there are improvements that can be made.
Number two is how do we strengthen, the capacity of civil society organizations to effectively advocate, on behalf of the citizen on issues that affect the quality, availability of health and social services.
Advocacy for Better Health created and leveraged platforms for social accountability, where empowered citizens raised their health-related concerns, provided evidence, and demanded action and accountability from their leaders. The platforms included advocacy forums at sub-county and district level and People's Parliament, a popular TV show produced by one of Uganda's leading television stations, NTV.
Yes, good evening viewers, those who are watching us from within the country and those who are in the diaspora. We are glad.
As a result, the responsible actors took action, such as building and equipping more maternity wards, deploying more health workers, and delivering more drugs to health facilities.
Previously, we were understaffed and the health workers who were at the facility were overworked. So Advocacy for Better Health, together with the district, made arrangements and some staffs were transferred to the facility to close up that gap. We also didn't have enough services at the facility, like gene expert testing for TB patients. We used it to refer samples to Iganga district, but with Advocacy for Better Health, we were able to acquire the gene expert machine, and now TB screening is purely done at the facility.
In its quest for improved health and social services, Advocacy for Better Health sought to influence health policy at national and district level. This was done through different and innovative strategies and tactics, some of them taking advantage of existing civil society alliances, coalitions, and technical working groups.
We have worked with other civil society organizations with the like-minded objectives, same vision, and we have worked with coalitions that existed. For example, we have worked with the Coalition on Maternal and Child Health to influence the policy on oxytocin storage. We have worked with CSOs working around HIV/AIDS to influence the absorption of health workers in HIV/AIDS area. We have worked with other organizations which are working on budget advocacy to influence the budget of the national budget to ensure that the budget in health has been increased. So in advocacy, you can't work alone and win.
The project ran a series of successful advocacy campaigns on HIV drug stockouts and human resources for health, including working with local music celebrities to compose educative songs on HIV, tuberculosis, malaria, maternal and child health under the Sing for Change campaign.
I'm an advocate for better health. I was given 2 areas. One on general health care and another one on dieting.
Mr. Government, politician, what about you?
I am happy to be part of this campaign, Sing for Change, where musicians are involved in communicating with our population by giving the right messages on health through music. I pledge to be part of this campaign so that we can reach out to all Ugandans wherever they are in order for them to appreciate that good health is very important.
We believe in growing the institutional capacity of the civil society organizations we work with, and therefore we emphasize the component of organizational development to strengthen these civil society organizations so that they can be able to receive funding beyond what we are giving them as Advocacy for Better Health project from different donors, including Usaid.
From inception, Advocacy for Better Health purposed to build capacity of selected local civil society organizations. This was mainly in the areas of advocacy, human resources, organizational management, governance, and administration, with anticipation that some would graduate to a level of receiving direct funding from Usaid and other big donors.
One of our core mandates was to deliver at least 4 CSOs with the capacity to manage large-scale health advocacy projects and then be primary recipients of USAID funding.
What I can say with the Advocacy for Better Health, it helped us to consolidate our various advocacy efforts. The number of times, there is a stock out reported here and you needed to have quick action. Can I have a media tour? Can I expound on this? Can I involve whoever I can engage? The Advocacy for Better Health came in to beef up the already existing work.
These CSOs were gotten from the 18 plus sub-awardees that the Advocacy for Better Health project was working with. So we used the criteria to select those that we felt were ready to be those prime recipients of USAID funding.
Advocacy for Better Health launched an internship and fellowship program aimed at creating a network of professionals with skills to support sub-grantees and community groups in building management and advocacy capacity.
I am grateful that I had to go through this internship program, particularly because of their own job training experience. I feel that they should continue training and helping out fresh graduates out there.
Across 35 districts and at the national level, more than 20 local implementing partners mobilized communities to demand and hold duty bearers accountable for health-related goals and commitments, from the facility to the highest levels of decision-making.
The key lessons that Advocacy for Better Health leaves behind is the approach of working with the community groups or the ultimate beneficiaries. These are the people in the communities who do not have a say, they don't have the voice, but they're the ones facing the challenges that we try to address. These community groups are there, they are existing, they are permanent, but what we did under ABH was to empower them, educate them, train them, and give them the tools to actually advocate and make sure that the issues that affect them are actually handled.